Hi, I hope everyone in Carmel is doing well and staying healthy at home. We can get through this if we work together, use common sense, and slow the spread of this virus down so our healthcare workers, our hospitals aren't overwhelmed, and our scientific community has time to find antivirals and eventually a vaccine. We do not want to have to be in the position of forcing our healthcare providers to make decisions about who gets a ventilator and who doesn't, as we saw in Italy and we're seeing in New York and New Jersey and New Orleans today. We have to slow down the virus, but we can do that by working together as a community. We made several decisions this morning based on the amount of use of portions of the Monon Trail. We've closed the Monon Trail because it was so busy. The closure is between Grado, which is at City Hall, up to Main Street, and includes the Midtown Plaza outside of Sun King and Fork and Ale. There was just too many people, and people were not able to socially distance as we're supposed to be doing during this time. We don't know when this closure will be over, but I want to point out to the community that we have 230 miles of other trails throughout the city, and we encourage you to get out and use those trails. We also closed the Brookshire Golf Course. While our city parks remain open, we've closed playgrounds, and playgrounds include basketball courts, tennis courts, other types of play areas where people come together and could spread the virus. I want to remind everyone that restaurants have been closed. This includes indoor dining rooms just as it does outdoor dining rooms. People are not allowed to sit in outdoor dining areas outside restaurants that are providing carry out. And unfortunately, we've had some violations of this, and the police are unfortunately about at the point where they're going to have to write some tickets to people who aren't paying attention to the governor's orders. We have to stop this virus and slow it down to give our hospitals time to catch up and our medical and scientific community time to come up with treatments and cures. I want to encourage everyone to get information about what the City of Carmel is doing by going to our website, www.carmel.in.gov. There you'll see daily reports. You'll see how every function, essential function of the City of Carmel is still continuing, albeit City Hall may be closed, but we're able to function electronically. Calls are being answered, emails are being responded to, bills are being paid, permits are being processed. We've got a great city staff, and they're continuing to work hard to provide essential services and keep everyone safe within the city. We have several EMS and first responders who have tested positive for the virus. As of now, everyone is relatively healthy and they're all recovering. We're continuing to quarantine some other first responders. Please keep them in your thoughts as we proceed over the next few days. We have launched a new initiative, and it's a hashtag on all the social media sites. Post your stories about how you're helping the Carmel community at hashtag Carmel Cares. I also want to provide some great news about how people in Carmel care. Our Chinese community, some of the folks involved with our Chinese sister city have arranged for the donation of well over 1,000 personal protection equipment items, masks and other equipment to our first responders in our hospitals, to our medical community. And we want to thank them for arranging that and making that donation. I also want to continue to encourage everyone to donate food or cash to our food pantries. They're listed on the city's website at www.carmel.in.gov. And don't forget to donate blood. We have many emergency surgeries that have nothing to do with COVID-19. And so I encourage everybody to go to our blood centers. They're safe, they're constantly being cleaned and sanitized, and continue to donate blood. Our hospitals need that blood. To close, I want everyone in Carmel to stay healthy. Together, we can handle this challenge. We can come out of this successfully. Stay home, stay healthy, take care of your friends and neighbors and your family. stay away from other people as much as possible so that we can protect the most vulnerable, the elderly, those with underlying health conditions that are most at risk for COVID-19.